Hello everyone, I'm Melanie Santos-Stefano from Vicarious Multimedia. We're here in the Vicarious Multimedia studios with Dr. Eugene Lipov. He is an expert in treating what is called PTSD, post-traumatic stress disorder. Though we're going to talk a little bit about that and it maybe not being a disorder so much as an injury, but we'd like to hear a little bit from you, Doctor. And first, why don't you tell us a little bit about your background with PTSD, your personal background?
Sure. Thanks for having me here. So I was born in Ukraine. I lived there. I was born in Cherkasy, Ukraine, in 1958. And I have been educated in the United States. I have become an anesthesiologist and a pain physician. And during practice of pain medicine, I was able to figure out that hot flashes could be treated by using an old procedure called Stellate Ganglion Block, which is an injection in the neck of local anesthetic. And then in the process of trying to figure out how it helped hot flashes, I was able to determine that it would work, Stellate Ganglion Block would work for PTSD. And then we were able to treat our first gentleman who was robbed at gunpoint, and he was on his way to be admitted to psychiatric ward. And then he was treated in 2006, and his PTSD symptoms went away. That led to my first publication in 2008, and then we went from there.
So how many people have you treated since that time?
For PTSD, I assume. I would say 2,500, something like that.
And then talk a little bit about the effect. Like, how long does it take for this treatment to take effect in an individual?
So the procedure takes about 5 to 10, maybe 15 minutes. The effects typically are seen 10 to 15 minutes, and it may last for months or years.
And you yourself actually had this treatment?
Yes, ma'am. I had my right-sided done 5 years ago, and left-sided done about 2 weeks ago.
And what was the cause of your PTSD? You had PTSD.
So my father had severe PTSD from World War II in a squadron he was in, fighting Nazi Navy. 10,000 people started and 100 people went home. So he came home. He was an interesting gentleman to grow up with. He was very impulsive and easy to anger, shall we say. And then that led to PTSD in my mother and myself. That's called secondary PTSD, and it's something I'm very passionate about, treating men or women with primary PTSD and secondary PTSD. That's where I had mine.
That's fascinating that you can actually not experience the situation directly, but the person that does can actually bring it back to the people that they live with or are close to. So that is interesting because you're multiplying the number of people that actually experience this challenge.
Correct. And to that, we are very interested in treating, for example, I was particularly interested in special forces in the United States. So we'd like to, we have treated now special forces, primarily men and their spouses. I'd like to also treat the kids because PTSD, unfortunately, doesn't really respect the age boundaries.
There are other individuals who experience this that have nothing to do with being, in the Army, Navy, Air Force, Marines. Talk a little bit about other individuals who are experiencing PTSD right now.
Yeah, so the largest cohort actually is survivors of sexual assault, primarily women. If you think about it number-wise, based on, I think it's FBI statistics, 1 out of 3 women in the United States in a lifetime will have a sexual assault. So 50% of those women will develop PTSD. So numbers are large. And first responders, about 25% of them have PTSD. Military, probably 25 to 40% will have PTSD, and so on. In fact, we published an article in 2022, so this year, and we looked at 22 different types of trauma. And we did stellates on all of those type of patients, and they seem to respond equally across the board.